40-year-old man wakes up in the morning. Drowsy, he heads to his bathroom and turns his shower up to steaming. As he reaches up to grab shampoo, his chest suddenly tightens. His breath gets caught in his lungs, and he can't move without pain all throughout his left side. What does he do? The immediate urge here is to call 911 for a suspected heart attack or cardiac event. There is merit to this. Our protagonist is over the age of 35, male, has chest pain, and discomforts on his left side. These are all symptoms of a suspected heart attack. So what does he do? He gets to the ER as fast as possible, and after a short examination, was dismissed. So what happened to him? Well, he came to my clinic, and after a treatment session, he left feeling 95% better. This is a real patient of mine and a true story. And just a quick disclaimer, no, chiropractors do not treat heart attacks. But what was up with this patient? This patient was presenting with unilateral, or one-sided, chest pain that reached from his back around his chest into sternal area. The pain originally onset from a very common movement, reaching and twisting overhead to grab a bottle. There was no trauma. He is also a very active individual and very meticulous in his diet plan. He has pain on inhalation and all thoracic movements. There were no neurological signs such as numbness down his left arm, and finally, physically feeling down the left side of his spine, found some very, very tight muscle knots. So what's the diagnosis? This patient was experiencing something that we refer to as a rib dysfunction, anecdotally referred to as a rib out of place. Rib dysfunctions are issues with the costovertebral joints or the rib spine joints, secondary to intercostal muscle spasm, which are the muscles between our ribs. When these little guys spasm, they apply tension to the joint capsule in our costovertebral joints, which we perceive as pain. One myth to put to rest is that rib dysfunctions are not actually the ribs moving out of place, although to the patient they sure as hell may feel that way. The rib head remains in the proper location, however inflammation is abound. Due to the proximity of the intercostal nerves right by the costovertebral joints, the resultant inflammation from a rib dysfunction may affect the nerve itself. This is why we may feel pain radiating into the front of our chest area with a rib dysfunction. For a rib to be truly partially dislocated or medically subluxated out of spot would require some pretty severe trauma. Think either motor vehicle accident or getting hit in the back by a baseball bat. The bad news with rib dysfunctions is that they can hurt like hell and usually come on for seemingly innocuous reasons. To individuals who have never had a rib dysfunction before or who don't know any better, they may honestly believe that they are having a heart attack. That's how bad the pain can be. I myself am no stranger to rib dysfunctions. I've been getting them since I was 15. In fact, I was the person who also thought he was having a heart attack, but was able to think my way out of that because last I checked, 15-year-olds don't get heart attacks very often. The good news is that they are not dangerous, usually resolve pretty quickly, and respond very well to chiropractic adjustments. Maybe I shouldn't say this, but this condition is actually comically nicknamed the moneymaker in a lot of chiropractic clinics, namely because the before and after comparison of a patient having a rib dysfunction and then getting adjusted is quite frankly night and day. The patient could be crawling into your clinic room and skipping out of it. For this particular patient, we took a pain that was rated an 8 on a visual analog scale and dropped it all the way down to a 2 in one visit. Why do rib dysfunctions happen? Well, it's the same reason that we would strain our neck or our lower back. Through improper movement patterns that our soft tissue structures are either not braced or mobile enough to achieve. Then how do we prevent them? Personally, whenever I am treating a patient with a rib dysfunction, I demonstrate and walk them through various thoracic mobility exercises. My 3 favorite thoracic mobility exercises to give my patients are the cat-camel exercise, the thread the needle exercise, as well as a seated thoracic twist. Knocking these guys out twice a day decreases the likelihood of them occurring, as well as decreases their severity should they reoccur. So the question for the average person to be able to answer then is how to distinguish between a rib dysfunction and a legitimate heart attack. One is an annoyance for the next 7 days, the other is potential death. One thing to look out for with a heart attack would be numbness down either arm or potential jaw pain. There is a belief that numbness would present down your left arm with a heart attack, but don't let numbness down your right arm, not your left, be the reason that you don't call 911. There is no reason that I can think of that a rib dysfunction would also present with numbness down the arm or jaw pain. Rib dysfunction pain will be provoked by certain thoracic movement. You will also likely be able to find a position that reduces the pain in comparison to other positions. Heart attack pain will more or less be consistent across all positions. Rib dysfunctions may be caused by small, seemingly innocent movements, most commonly being rotational, or on deep inhalation. Cardiac arrests don't necessarily need a movement component for them to onset. And finally, Additionally, a rib dysfunction will have a very obvious focal point of pain beside the spine. If you were to feel down with your hands, there will be a spot which, when pressed on, will greatly provoke the pain. A heart attack will have no such focal spot. Referral will probably be everywhere. The last thing to note before we sign off for this one is that a healthcare practitioner will probably be able to very easily distinguish between a rib dysfunction and a true heart attack. However, to everyone that is not a healthcare practitioner, it is way better to call 911 if you think you are having a heart attack. It is far better to make an unnecessary call and everything be okay than for you to not make a necessary call and to, yeah. Thank you so much for watching, guys. I really do appreciate it. If you could subscribe, that would be fantastic. You can click here for the previous video and you can click here for the most recent one. Thank you again. Have yourselves great days.